name is Samantha Wilkins, and I will be your nurse today, and I will be doing your physical assessment. So can you tell me your name and date of birth?
Ruby Wilkins, October 2nd, 1964.
Okay, so I'm going to look at her armband. All right, and I'm going to close the curtains to ensure privacy, and we're going to start our assessment. So her history has already been done, so we're going to pass that. I'm going to start off by inspecting her head and her face. I'm going to inspect the scalp, the cranium, and her face. So her face, her scalp, and her cranium. And they are all symmetrical, no nodules. I'm going to inspect her temporal arteries. Okay, and they're fine. I'm going to inspect her TMJ joints on the jawline. So I'm going to ask her to open and close your mouth. Okay, close. All right, and they're symmetrical. I'm going to do cranial nerve 5, so I'm going to ask you to clench your teeth. And can you feel this combo?
Yes.
Okay. So also, I'm going to do cranial nerve 7, so I need you to smile big, frown, close your eyes tight, show teeth, and then puff out your cheeks. Okay. So now we're going to test cranial nerve 2 with the Snellen's chart, so I'm going to ask you to stand right here. And I'm going to go over here. So, show her the Snellen's chart. Come on. This is my chart. So, can you read line 5? Yes. Okay, you can show her. Read it for me.
PECFD.
Close the right eye. Cover the right eye. Okay, line 5.
PECFD.
Okay, left eye.
PECFD.
Okay, so she has 20/40 vision. You can sit back down. We're going to test cranial nerve 3, 4, and 6 with my pen light. And I'm checking for equality, regularity, response to light, and I'm going to check accommodation. So look straight ahead. Okay, so her pupil size is like a 4, and she is Perla, and then follow this pen. Okay, and accommodation as well. So I'm going to inspect the eyeballs, the eyebrows, eyelashes, and eyelids, and they are symmetrical, no nodules noted. The cornea had no spots, the sclera had no spots, and the conjunctiva had no spots. Also, there was no drainage. So now we're going to inspect the ear. So I'm going to look inside your ears. Okay, and there I'm good, no drainage. We're going to do cranial nerve 8. So I'm going to cover one ear and whisper something into you. You tell me what I see, okay?
Basketball. Soccer.
Okay. So now I'm going to assess your nose. So I'm going to look at your nose and palpate. It is symmetrical, no nodules. So can you hold one nose and sniff? And then the other one. Okay. No drainage, and it is good color. And then we're going to palpate the sinuses, and it's the maxillary and the frontal. And they are symmetrical. So now I'm going to check your mouth. So I'm going to check your teeth, mucosa, gums, tongue, floor of the mouth, the palate, the pharynx, and the uvula. So say ah. Look at the roof. Hold your tongue up. Okay? Say ah again. Uvula moves up and down, symmetrical. And she is pink and moist. Now I'm going to check her gag reflexes. That is cranial nerve 9 and 10. So stick your tongue out and say ah. Okay, I'm gonna press again. Tongue out. Okay. Okay. So now I am going to palpate your lymph nodes, and it's a lot of these. It is the preocular, the postocular, the occipital, the submental, submandibular, tonsillar, superficial cervical, deep cervical chain, subclavicle, and the post-cervical. So basically, I'm just going to go up and down and palpate lymph nodes on your chest. And on your neck. Okay, and there's no nodules noted. I'm going to do cranial nerve 11, so that's range of motion. So can you do chin to chest? Okay, so bend your head back. Okay, side to side. Okay. So now I'm going to check resistance. So turn side to side. Okay, and she is symmetrical. I'm going to palpate your trachea and your thyroid. So we're going to, trachea is around here, and your thyroid is to the sides. Okay, so now I'm going to check your carotid artery. So we're going to go here. 2 plus equal. And 2 plus an equal. I'm going to listen with the bell of my stethoscope. All right, and there are no bruises noted. So I'm going to ask you to turn to the side as we have to take your shirt off. Take it off. Yes. Off. Yes. Or you can just lift it up. Okay, so she is bearing down, but I'm inspecting her back, okay? Come to see her back. Good. So I'm palpating and I'm just looking, and it is clear, no nodules, and it is symmetrical. I will check for firmitus. So can you say 99?
99.
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 Okay. So now I am going to listen to lung sounds. Breathe in for me. Breathe in for me. And again. Again. And again. 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 And again. Again. And again. Okay. Now I'm going to percuss. Percuss the flank. Any pain?
No.
Tenderness?
No.
Okay. So now you push her back, put it back down. Now I'm going to assess your upward extremities. I'm going to palpate the arms, and I'm going to feel the radial, brachial, and ulnar pulses. Okay.
Mm-hmm.
So I'm looking at your arms. They are nice in color, no discoloration. They are nice and warm and symmetrical. So these are her radial pulses. And they're 2 plus and equal. These are her femoral pulses, not femoral, these are her ulnar pulses. And they're 2 plus and equal. And these are her brachial. And they're 2 plus and equal. So now I'm going to check your capillary refills on your fingers. And they are less than 3. We're going to do range of motions with your shoulder. So can you go out? And then go back, front, down. So do adduct, abduct. Okay, so I want to do it against resistance. Try to pull your shoulders up. All right. So now we're going to do range of motions on your elbows. So can you go up, down, pronate, which is inwards, and supinate is outward. So go back here and try to pull up against resistance. Okay? We're going to do range of motions with your wrists and hands and fingers. So can you do this for me? Okay? grab, fist, extend, hyperextend. Okay. So then make each finger touch your thumb like that. Okay. So we're gonna finger to nose test. One finger to nose. And then with the other. All right. Now we're gonna do a reflexes of your triceps, biceps, and brachial. So we're gonna do like this. This is her tricep right here. Just hang limp for me. She did jump. This is her bicep. Nothing happened. And then this is her brachial. And she did jump a little. Okay, so now we are gonna look at your chest. So can you lay flat for me now?
This side?
Yes. Take your shoes off. Okay, so we are going to palpate the interior and of her chest. So I'm just gonna look down in here, and it looks good. No discoloration, no nodules noted. I'm palpating the PMI, middle of the chest, and it shows no pulsations or no thrills. And I'm gonna listen to her heart sounds. Okay. So we got aortic, pulmonic, tricuspid, and mitral. Now I'm going to listen to it with the bell. Aortic, pulmonic, tricuspid, and then mitral. She is also using no accessory muscles to breathe. Okay. So now I'm going to look at her abdomen. I'm going to pull your shirt up slightly. So I'm inspecting the abdomen. It is no odd color, no discolorations, no visible pulsations, no visible peristalsis. I'm going to look at her belly button, and it is fine. No visible hernias, and the color is well. So I'm going to listen to your bowel sounds in all 4 quadrants. Then I'm going to listen to your aorta and renal arteries on the sides of your umbilical cord. Her bowel signs are hypoactive. I'm listening to her aorta and bilateral renal arteries. I listen to those with the bell. Okay, I'm going to percuss all 4 quadrants. Any pain?
No.
Tenderness?
No.
Okay. I'm going to lightly palpate, then I'm going to deeply palpate, okay? This is the light. This is the deep. Any pain?
No.
Tenderness?
No.
All right. So now I'm going to palpate your liver, which is on the left side, right above the ribs. And I cannot feel it. Okay. So now we're going to look at her lower legs. We're looking at color. They're a nice color. No edema noted. We're going to inspect the popliteal, the posterior tibulitis, and the dorsal pedis arteries. So, palpate. And they are 2 plus and equal. They are 2 plus and equal. And they are 2 plus and equal. Okay, so now we're going to check range of motion of your legs. So can you lift one leg up 90 degrees? And then the other. Knee to chest. Okay. Then I want your knees to go in and out. Okay. So now we're gonna check your reflexes. I'm gonna do the Babinski test. So you just stay put, let your feet up. Her toes should curl down. And then we're gonna try again. Okay. So also, can you move your feet up? Like go up like this? Like feet down, feet up. Okay. Against resistance, go down and go up. Okay. So now you can swing back over to the side. I'm gonna test her Achilles. So I'll just dangle your feet for me a little bit. And that did jump. Yeah. So now I'm gonna check her patella. So dangle your feet as well. And she did jump. Okay, so now we're gonna do the cerebral test function. So you get your foot and you go down your shin for me. You do it on each leg. Okay. All right. Now we're going to get you to stand up. I want you to walk on your heels in place. Okay. Walk on your toes. Okay, so we're gonna do Romberg test. So I want you to sit there, close your eyes, stand up straight. Close your eyes. Okay, and she is not swaying. Okay, so now I want you to hop on one leg, on both legs. Okay, next leg. Okay. Now I want you to bend forward. I'm gonna inspect your spine. And there's no curvature. Okay, I want you to bend backwards. Okay, come back forward, touch your toes. Okay, come back and go side to side. Okay, great. So I need you to sit down. This concludes my physical assessment. Right in the middle.